Hello everyone, I just want to thank you all for stopping by my channel. If this is your first time here, welcome, and if you are a part of this channel as a subscriber, I just want to thank you for your continued support. So today we will be going over OBGYN Nclex questions. So this video is great for those who are preparing for Nclex and just want to practice some more OBGYN problems. So you will get the problem read to you and the rationale. Alright, so let's get started. The practice Nclex question reads, the clinic nurse prepares to assess a client who is in the second trimester of pregnancy. When measuring the fundal height, what should the nurse expect to note with this measurement regarding the gestational age? Is it 1, it is less than the gestational age, 2, it correlates with the gestational age, 3, it is greater than the gestational age, and 4, there is no correlation with the gestational age. So I'm going to give you some time to think about it. So the answer is 2. Until the third trimester, the measurement of the fundal height will, on average, correlate with the gestational age. Therefore, options 1, 3, and 4 are incorrect. So the correct answer is 2. The practice Nclex question reads, the nurse is assessing a pregnant client with a diagnosis of abrupto placenta. Which manifestations of this condition should the nurse expect to note? Select all that apply. Is it 1, uterine irritability, 2, uterine tenderness, 3, painless vaginal bleeding, 4, abdominal and low back pain, 5, strong and frequent contractions, 6, non-reassuring fetal heart rate patterns. I'm going to give you some time to think about it because this is a select all that apply. So if you chose 1, 2, 4, and 6, you are correct. So again, 1, 2, 4, and 6. So placental eruption, also known as abrupto placenta, is the separation of the normally implanted placenta before the fetus is born. It occurs when there is bleeding and formation of a hematoma on the maternal side of the placenta. So manifestations you will see is uterine irritability with frequent low-intensity contraction, uterine tenderness that may be localized to the site of eruption, aching and dull abdominal and low back pain, and painful vaginal bleeding, and high uterine resting tone, identified by the use of intrauterine pressure catheter. So additional signs include non-reassuring heart rate patterns and signs of hypovolemic shock and fetal death. The nurse is caring for a client in active stage of labor, is monitoring the fetal status, and notes that the monitor strip shows a late deceleration. Based on this observation, which action should the nurse plan to take immediately? Should you 1, document the findings, 2, prepare for immediate birth, 3, increase the rate of the oxytocin infusion, or 4, administer oxygen to the client via face mask? So I'm going to give you some time to think about it. So if you chose 4, you are correct. So late decelerations are caused by placental insufficiency as a result of decreased blood flow and oxygen transfer to the fetus. So this can cause hypoxemia, therefore oxygen is necessary. A client diagnosed with gestational hypertension has been admitted and is in early active labor. Which assessment findings should the nurse most likely expect to note? 1, increased urine output, 2, increased blood pressure, 3, decreased fetal heart rate, 4, decreased brachial reflexes. Maybe some time to think about it. So if you chose 2, you are correct. So the major manifestation of gestational hypertension is increased blood pressure. The practice Nclex question reads, a pregnant client reports that her last menstrual period was February 9, 2018. Using Nagel rule, what will the nurse determine as the estimated date of birth? All right, so you see your options over there, so I'm going to give you some time to calculate. So if you chose 4, you are correct. So the accurate use of Nagel's rule requires that the woman has a regular 28-day menstrual cycle. To calculate the estimated date of birth, the nurse would subtract 3 months, from the first day of the last menstrual period, add 7 days, and then adjust the year as appropriate. So the first day of the last menstrual period was February 9th, 2018. And we're going to subtract 3 months, which takes us to November the 9th, 2017. And then we're going to add 7 days, which brings us up to November the 16th, 2017. And then we're going to add a year, which will give us November the 16th, 2018. So the correct answer is D. The practice Nclex question reads, the nurse is caring for a client in active labor. Which intervention should the nurse implement to prevent fetal heart rate decelerations? Is it 1, discourage the client from walking, 2, increase the rate of oxytocin infusion, 3, monitor the fetal heart rate every 30 minutes, or 4, encourage upright and side-laying maternal positions? So, if you chose 4, that is the correct answer. So, side-laying and upright positions such as walking, standing, and squatting can help improve venous return and encourage effective uterine activities. The practice Nclex question reads, a clinic nurse is caring for a client with a suspected diagnosis of gestational hypertension. The nurse assesses the client, expecting to know which set of findings if gestational hypertension is present. So, is it 1, edema, ketonuria, and obesity, 2, edema, tachycardia, and ketonuria, 3, glucoseuria, hypertension, and obesity, or 4, elevated blood pressure and proteinuria. All right, give you some time to think about it. So, if you chose 4, you are correct. So, gestational hypertension is the most common hypertensive disorder in pregnancy. It is characterized by the development of hypertension and proteinuria. So, that means proteinuria is protein in your urine. So, the correct answer is 4. The practice Nclex question reads, the hemoglobin levels of a client in her first trimester of pregnancy are indicative of iron deficiency anemia. Which assessment findings support the diagnosis of this type of anemia? Select all that apply. Is it 1, a yellowish sclera, 2, reports of severe fatigue, 3, pink mucosa membranes, 4, increased vaginal secretions, 5, reports of frequent headaches, or 6, reports of increased frequency of voiding? So I'll give you some time to think about it because it is a select all that apply. All right, so if you chose 2 and 5, you are correct. So reports of severe fatigue and reports of frequent headaches are signs and symptoms of iron deficiency anemia. The practice Nclex question reads, a postpartum nurse caring for a client who delivered vaginally 2 hours ago palpates the fundus and notes the character of the lochia. So which characteristics of the lochia should indicate to the nurse that the client's recovery is normal? Is it 1, a paint color lochia, 2, white color lochia, 3, serosanguine lochia, or 4, a dark red color lochia? So I'll give you some time to think about it. So if you chose 4, you are correct. So when checking for the patient's lochia, you want to make sure that you look at the amount, the color, and the presence of clot. So the color of the lochia during the 4th stage of labor is dark red.